Hi, everybody. This is your host, Mr. Allen. Welcome to another episode of our podcast. I feel like I have news each one of my podcasts, and it's been a while since I've recorded one. And here in Texas, our COVID cases have gone up, and so the Governor Abbott has required a mandate to wear masks in public whenever we're going anywhere to help like prevent the spread. And I know that a lot of people are frustrated. A lot of people are ready for this to be over, to return to normal life. And I'm right there with you. It is very difficult. It is hard to be able to live like this. Um, and the way that it helps me get through it is really to want to help other people. And so so I would just encourage people to do your best that you can, to practice the guidelines, wearing our masks, keeping our distances, washing our hands, just doing things just to keep ourselves safe, so that we can do our best, so that we can hopefully get into a position where we can put this behind us, and we can start continuing being safe, but as well resuming back to normal life. And I mean, I wish I could tell you when that is, but I really have no idea. Um, but I want to say something that I am really excited about today. So today, I get to talk to my guest, Dr. Anu Partap, who is the director of the Center for Prevention of Child Abuse and Neglect with Cook's Children's in Fort Worth, Texas. Cook's Children's is such an incredible resource and partner here in the DFW area. Something that I read about that I thought was really great is that they embrace this promise to improve the health of every child in our region through the prevention and treatment of illness, disease, and injury. And I can honestly say that I see this work, and I notice that they do everything that they can to live up to that promise, with a lot of teams to address a lot of different issues to improve overall health, to individuals, families, and also just to the entire community. And they are such a huge part of the community, especially where I work, which is in Fort Worth. And so I'm really excited to talk to Dr. Partap today to hear about her knowledge and expertise and how her team is impacting the community. And so please hold on for a moment, and I'm going to have Dr. Partap join me soon. We are back. I would like to introduce my guest, Dr. Anu Partap, who is the director of the Center for Prevention of Child Abuse and Neglect with Cook Children's. And I just want to thank you so much for jumping on today. And kind of like I told you earlier before we introduced ourselves, how excited I am with your experience and all that you've done. And so I'm just so excited to talk to you today.
I'm excited to be here. This is a first for me to do an online video interview during COVID. So I applaud you all for taking this on for people. Thank you.
Yeah, of course. And so I guess I wanted to talk about that before, because this is kind of how I started the podcast because of this, and we have to start doing more online content. And so like, how are you doing? And like, how has your life and work changed during this pandemic?
Yeah, so like for lots of folks, it was one day things were one way, and then Cook Children's really had a responsibility to really mitigate and minimize the spread of infections. So a lot of us who could work from home were moved to work remotely. So this is our play room at home that became my office very quickly. And we were able to also, needed to also, how do we shift our work, right? So what was relevant maybe weeks prior quickly changed, especially with child abuse and neglect. So we had to pivot the work we were doing as well as moving remotely. And like lots of parents, my kids were then quickly moved home as well. So trying to have everyone under one roof with different agendas was an interesting transition. But yeah, so I can share the suffering and the joys, I guess, of being home with everybody else. Yeah.
Yeah, and I found that difficult too, because you were used to this one type of life, like how we were working and impacting lives and everything. And since the pandemic, we had to change, we had to shift. And it's been a challenge. Like, how are we going to do that now? And so I think that it's just interesting hearing other people's perspectives as well about that.
Yeah, and if anything, it might be really eye-opening for all of us on the service side because we're sort of living what a lot of families experience every day.
Mm-hmm.
The separation, isolation, being remote. For us, it was forced, but for a lot of other families, it's just their day-to-day
Right.
existence. So maybe if anything comes out of it, we'll have that sort of raised empathy or awareness, maybe.
Right. Yeah. Yes, that's true. That's a really good takeaway. So I want to get into it because I know that you're busy and want to get as much information as I can. And so I did some research on you through Google, reading articles and everything. And so I've seen that you've been a pediatrician for over 20 years now. And so I'm just curious about your journey of what made you want to become a pediatrician, and like could you tell us kind of what the journey was like to becoming
Yeah, so what's funny is I went to medical school knowing that the only thing I was not going to be was a pediatrician.
one?
Like certain, I'll be anything but a pediatrician. And then late in medical school, we were required to work in a children's hospital. And I was so inspired by my faculty advisors and mentors. They were amazing at the bedside with really nervous parents, with really sick children. The way they kind of blended public health, the art of medicine, the science of medicine, whether the patient was a baby or an 18-year-old in the very next room. I was just sort of fascinated and in awe of needing to be that flexible and intuitive about what families need so that their children can do well. I think too, for me, for pediatrics, if I can inspire anyone to become a pediatrician, because it's the most fabulous job in the world, it's that there's so many conditions out there, and yet there's a lot of hope and treatment for many of them.
Mm-hmm.
And so to be able to be a part of a child and family's journey from a really scary place, usually to a place of healing, not always, but even to a place of alleviating suffering, it's incredibly gratifying.
Yeah.
But it was a longer road for me because I just didn't know that that's what I was going to do till later. Um, there's this technical side to the journey too, right? There's that you have to go to undergraduate for 4 years, you do 4 years of medical school, you pick your specialty. That's 3 years, at least for pediatrics, it might be 5 years. I chose to do a fellowship to do research and teaching for another 2 years, especially around trauma issues, and got my master's in public health. So you can drag it out too, but I did get lucky enough to do a 6-year combined program where out of high school, you decide you want to be a doctor, and I knew I wanted to be a doctor when I was 5. And so picking a combined program out of high school was real easy for me. But you save a couple of years doing that too. So
Yeah. And I completely identify with what you were saying about not really choosing to work with children, because when I went to graduate school to be a counselor, I was expecting to work with adolescents, like older kids, and then I got this position with Boys and Girls Club, and I thought I was originally going to work with the adolescents, but they actually put me with the elementary school, and I loved it. Like, I did not realize how much joy and how much fulfillment it gave to me working with such young kids and everything. And so, yeah, I think it's just so crazy, like how we can have a goal, like we can have a thing in our mind of what we're going to do, and then it just changes completely whenever we're put in a different situation.
yeah, agreed. And you're also shaped so much by your environment, right? So I mentioned I knew I wanted to be a doctor early because my parents are doctors. So I had that sort of advantage of seeing it, living it. We were dragged to the hospital all the time, had to work in my mom's lab. It wasn't a choice, but
Right.
it also just became part of what I saw myself doing. And it's interesting how by chance that is, right? Like if I'd had a different set of circumstances, you might end up differently. But it reminds me how much we have to be really aware of our children's environments, our patients' environments, because that really led to me getting here to do this interview with you. So it's kind of
Yeah.
interesting.
Awesome. Yeah. And so I want to talk about your current role. So you're the director of the Center for Prevention of Child Abuse and Neglect with Cook Children's. And so could you tell us about the purpose and vision and hope for the Center for Prevention of Child Abuse and Neglect? Because I think a lot of people aren't aware that Cook Children does this.
Yeah, so the center is about 5 years old. I've only been there 2 years,
Hmm.
and it's really unique in our state that a children's healthcare system committed to having a prevention center. And I think the goal has always been that there would be a way to really focus on eliminating child abuse, alleviating suffering or likelihood of child abuse and neglect, and really even focused on recovery. If you have the unfortunate experience of being a victim, how do we make sure that it doesn't hold you back, but you can still be the child that you were meant to be? The center focuses really around research, exploring programs that might be effective to look more upstream, and also making sure that we help people receive training or education to identify children early or families who are struggling early so that we can do either early detection or prevention. And so those are kind of the areas that the center is focused on the most.
Okay. And so I wanted to, because so this is an area that we work in, and so I was curious, and I don't know if things have changed since COVID and everything, but my understanding was that your team did have a project working in the Stop Six area. Could you talk to us a little bit about that?
Yeah, a couple of years ago, our CEO at Cook Children's, Mr. Merrill,
Hmm.
he realized that there was a role for Cook Children's to focus on what's called adverse child experiences or ACEs. And we really decided to assemble leaders in our community and say, what can we do in the space that we know families who experience adversity don't choose it. Oftentimes, they are struggling with adversities they want to change. And how do we support families in that so that we leverage our expertise and resources and compassions together? And we looked around and thought, it's one thing to do things at a real systems level, throughout a county or throughout a city, but there's something to be said about working with people side by side, more of a grassroots, and saying, what can you teach us as service providers about how we can better serve?
Hmm.
And in looking around, Stop Six leaders and families welcomed us in to learn from them what we can do a better job with across systems of care. And that work has really, honestly, in the 25 years of doing work related to adversity, trauma, um, it has been incredibly gratifying and eye-opening. I learned a lot taking myself out of an exam room and into the community, what I call sort of instead of bedside, it's more curbside. And it's really because the families have been so welcoming and honest with us. What those conversations have translated to are, a lot of families know exactly what they need. They know what the struggles are, they know what the gaps are, and their experiences. We reach out and reach out and reach out, and we're just not able to get the service we need, or we know it's out there, we just can't find it. So we took that information and they actually suggested to us it'd be great if we could just text. So that led to actually a countywide initiative to add a texting resource navigation system that should be rolling out within a few months. It's in partnership with Tarrant Cares, which is really run out of the Mental Health Connections and through the Office of Judge Glenn Whitley. But that's an example where that conversation happened in Stop Six, which will now help thousands of families in Tarrant County. Another aspect of what we learned from our families out there with our project is we know that adversity is really important, especially in the early years. It's
Hmm.
always something you want to tackle, no matter how old you are. But
Sure.
these formative years for brain development, the neuroscience behind it, we reached out to families with young children especially. And what we were trying there is, families know their children better than anyone, right? The parents know what's happening. So how do we have a conversation so parents can realize, oh, what's happening to me is affecting my child without it being always punitive or you're in trouble or now you've fallen really far behind. But what are the early signs that there may be trouble? What are the early ways to have parents support their own children? And so we've been doing a pilot with parents out there, again, through their gracious acceptance of letting us in. And that has led to a lot of really thoughtful learning for me as a service provider around where we can do a better job as a community. And so that's another pilot that's happening.
Okay.
Yeah.
That's awesome. And I know that that's something I don't know whose team came, but I know for a training maybe a couple years ago, Cook's Children came to one of our trainings and they taught us about the ACEs study and like trained us and also like had us like do the questions and everything. And so it's just I mean, and so I can attest for working in the DFW area that I see you guys doing these things and like getting out there. And I think that's just awesome. It's just very much needed, especially in our community.
Yeah, I feel very lucky to get to do this work. It's
Yeah,
really
me
amazing.
too. Yeah. And so I want to talk about, so you mentioned trauma. And so trauma is a really huge topic lately. Just because I feel like we're all going through some trauma just with the pandemic, with recent racial tension that we've been going through. I mean, there's just a lot of things that people are processing through right now. And so, and so I'm just kind of curious to start off with what led you to focus your work on like helping children who have experienced trauma like abuse and neglect.
So it's interesting. When I was about 20, I was in college and I decided to go to an evening talk, and it was a woman who was a survivor of intimate partner abuse or domestic violence.
Mhm.
And I listened to her describe her experience, her escape, her survival, her recovery, and then she became this advocate so that this didn't happen to lots of other women. And I didn't really understand domestic violence until I heard her speak. But the very week after that, I went to clinic and I'm like, well, let me just ask the next female patient I have. And I did. I asked. I probably didn't ask sensitively or the right way, but I asked. And she shared that she was in an abusive relationship. And from then on, week after week, patients were disclosing histories of sexual assault, domestic violence, and these were the same patients who were struggling with depression, anxiety, what we call non-compliance in medical school or in medical care, really. The same patients who would be admitted repeatedly. And it was just so obvious to me that I wasn't making any, I wasn't helping anyone with their medication regimens and bringing them back to clinic over and over and helping them when they were hospitalized. As long as their traumas, their abuse, their memories were holding them.
Mhm.
I think those factors were still undermining their ability to be healthy and well and whole. And I decided midway through medical school that I was going to get my master's in public health and I was going to work on these issues with adults initially because I hadn't chosen pediatrics. But it's really just been a commitment since then because even before the ACE study was published, it's so obvious this interconnection between our life experience, particularly when it's negative, and the way that ripples throughout our emotional health, mental health, physical health, our lifestyle choices, um, where we live, what jobs we have, all of those things, whether we graduate from school. And so for me, it's been very meaningful to intentionally have a career path where I've integrated access to care, recovery services, and abuse and neglect and ACEs into how we do a great job with the day-to-day practice of medicine. That these are intertwined, they're not separate.
Yeah. And so you talked about this a little bit earlier, but like, why is it so important that we address like a child's trauma early in their life?
Yeah, so I always kind of think like our grandmas know that what happens to kids at home affects them, right? So it's
Right.
been a long time known just informally, but the science showing us the pathways of how early life adversity affects brain development is has been transformational for me as a physician, but also really is a call to action for everyone to think differently about how we engage with families, no matter where we meet families in. Because what it looks like is that as the brain is developing, when there are external stressors that actually interrupt the caregiver's ability to bond with their little one. When the caregiver is not able to be an available, nurturing, protective caregiver, that scariness, that neglect, that trauma, whatever is stressing that child, that little brain during its developmental stages, can take hold and create pathways that last a lifetime. So to think of, like I'm a mom. So when I look at my girls, I have to be very intentional that when they were younger or even now, if there's really scary things happening, life is hard. Things are going to happen. But if I don't protect them through that, the idea that as an adult they might have heart disease or diabetes or obesity really gives me pause as a parent to realize I need to be really careful about how I protect their brain development through this scary time. The younger you are, there's two real problems. Is that one is brain growth is so rapid that the environment has a much bigger role prenatally to age 3 to 5, somewhere in there. That is a great time to have a nurturing, protective environment, whether not just in your neighborhoods, but in your home with the caregiver that's raising that child. The other is that the younger you are, the longer you have, in a good way, to interrupt that, right? And recover and heal and move on. But also the longer you have in a risky way. If it starts at age 1 and we don't interrupt that, you have a lifetime of trauma. Mm-hmm. And so when the adult is struggling and we're frustrated, we needed to dive in when they were younger. And I think all of us have this exciting position to look at families who have young children or who are pregnant now and looking forward to the birth of their child to say, these are the years you can really shape your child's lifelong health, stability, emotional health, connection, and guide families how to do that.
Yeah, and I love when people talk about the brain, and because I feel like it is so important, and like how trauma affects the brain, because the brain is really like the thing that controls, like drives us, like helps us be able to regulate emotions, be able to help with learning in schools and everything. And so like how trauma has such a big impact on being able to do those things, and that's why it's so important. And so I feel like just through this whole time, like it's been very important to learn more about trauma, and just hearing your perspective on like why it's so important, like for a child to learn, to be able to help them through that early. Because you, like what you said is, and this is something that you can see in Dr. Burke Harris's TED Talk, is how it doesn't just affect them now, but affects their life, like health consequences as well. And so it's really not just about the person, but it's also like it's also like on the economy, like society as well. It benefits to be able to intervene for trauma in that way too.
Yeah, because the science part of it is when there's trauma in early life, it actually triggers through an abnormal higher level of inflammatory responses with your cortisol level and others. Mm-hmm. And that's sort of like when your system is revved up because of stress. So if you have unmitigated stress, you've got a scary thing going on at home day after day, but no one protects you through it. And now you're supposed to be stressed because that's part of survival, right? But when it's chronic stress, or what we call toxic stress,
right,
that the hormone levels that are released actually affect almost every organ in your body. And I love that you mentioned learning, because the way this shows up in little ones is they don't sleep well, they don't eat well, and they have developmental delays. So when we meet, a 2-year-old who isn't quite using their arm or their fingers correctly, or they're 3 or 4 and they're not talking, or they're 1 and they are not sitting up, any level of developmental delay, we tend to focus on, well, let's fix the developmental delay. That's the same thing as an adult doc saying, let me just fix your hypertension, right? Without realizing where's it coming from. Mm-hmm. And so in young children, sleep, mood, developmental delays, difficulty learning, eating, peer relations, rashes, uncontrolled asthma, um, dental caries, obesity. These are all ways that household stress and a disrupted nurturing caregiver relationship show up. So it shows up in really common ways, but we have to sort of pause and say, could this be a trauma response? Because we know that stress and trauma, when a caregiver can't protect you through it, upregulates your stress hormones, which shows up in these different ways in your body. The balance, though, Alan, I think, is that it can feel very final. It can feel kind of hopeless when families learn too much about the impact of adversity and stress on the brain and not realize, oh, this is temporary. Like, I have to be aware and mindful. It's already showing up. What big changes can I make, or small changes can I make? Can I read a little bit more? Can I hold my baby a little bit more? It can, whatever stressor is happening in the home, can I remove it once and for all? If a parent is struggling with depression or addiction, I think sometimes when they finally see how it's affecting their young child, especially, that's the moment that families can choose help, right? That's when they're ready to accept, oh, I can't live like this anymore. It's affecting my children. Mm-hmm. And then the next part of that is the recovery. So everything we see in children, the beauty is there's resiliency, of course, but there's recovery. It's not just resiliency. It's now we have to intentionally help this child and parent reconnect, help them receive treatments they need for any impact they've had from living with trauma and stress and adversity, and really help them become the child they were meant to be when they were born. And so I think it's like all of those pieces. It's understanding the science, but not just the really horrible parts that can happen if it's unmitigated, but then all the hope that there is for changing that trajectory.
Right.
Yeah.
And so I wanted to ask you, because you talked about your role as a parent, like for your child, and I'm kind of curious, like, so because trauma can be past generations as well, and so say like a parent has experienced trauma in their own life, and they're aware of that, like how can they help their children? Like when they're kind of dealing with their own trauma?
Yeah, it's a really good question. So I'll again come back to Stop 6 for a moment. We worked with community leaders there that are really amazing grassroots leaders. And we actually, touching on what you're saying, is we came up with a slogan, connecting generations. And the idea was, how do we connect our older generations with our younger generations? Because healing and trauma is intergenerational.
Right.
And with parents, I think, I call them trauma tattoos. So trauma doesn't have to all be seen through a lens of being something that was bad. It can be bad if it's still holding you back, but it's also what you survived. Mm-hmm. It's what makes you strong. Right. It can shape you in ways that are positive and beautiful and loving and kind. And so if a parent has a history of trauma, to describe their history in those terms really allows their children to see, if this happens to me later, I'll be okay because my mom or dad is someone I admire and they've made it. Mm-hmm. Or if a parent is raising a child who's newly traumatized, is really stressed, they've experienced things they didn't want to, for a caregiver of any level to say, you know, I've been there and this is how I got through it. If a parent hasn't yet gotten through it, right? They've experienced trauma of any kind, sexual abuse, physical abuse as a child. Maybe their parents had an addiction. Maybe they're in a violent relationship now. When they feel the belief that they can live a safe and healthy life, that they deserve that, then their healing can begin too. I would say that children really have a hard time living successfully if their parents have unresolved trauma. It's really hard because it just comes through in our parenting, it comes through in our expectations of our kids. And if the trauma is something that our kids are living with because we're living with it, they're experiencing it all at the same time that we are. So it can be seen as we always have to be aware that as a parent, as a mom, I'm aware that how I'm living every day matters for my children and their dad. My husband knows that too. It doesn't mean every day has to be great or even good. You can have bad days, but you certainly have to be able to take a look at the big picture and say, okay, my overall experience for my child is what? And figure out if how you turn your own stories into positive ones or change your story now. So does that make sense? I hope I explained that well.
Yeah, of course. Yes, thank you. And I love what you're saying because I feel like you're giving a lot of hope. With what we've gone through, there's still a lot of hope that you can have and a lot of things that we can do to work through those things. And I think that's just so important. And I think that something you said earlier, like that you could feel doomed. And the thing is it doesn't have to be that way. There is a lot of hope and there's a lot of resiliency. There's a lot of strength that comes through going through adversity. And so that's just really inspiring to me to hear. And so I wanted to talk about, so I looked up your work history. And so it looked like from 2009 to 2018, I saw that you did a lot of work providing medical care and support to foster children. And so my question is, like, working with that population, did a lot of foster children experience trauma that you saw that could contribute to long-term physical and mental health problems within the system?
Yeah, so the short answer is yes. I think foster care is, really a legal status, right? So if you're in foster care or were in foster care, it means that a group of people felt that you were, as a child, unsafe to remain in your family home, that you could not safely live there in that moment. And so you were removed from your family environment in order for you to be safe. There's two things that happen for our kids in care, and that is whatever circumstances were occurring that led to people taking you away from that is traumatic, right? So if you were living in a home where either yourself or your sibling was injured, neglected, the household was not taking care of you for whatever reasons, and you're taken away, that whole life prior to entering foster care was one that we call complex trauma, chronic trauma. If you're a newborn and your mom has an addiction that is serious enough that you have to be removed, there's still the exposure to drugs prior to birth, right?
Mm-hmm.
The second piece is that the simple act of rescuing you, right, and placing you in a home, even if it's your relatives, you may not know them. Sometimes you're lucky enough to know them, sometimes you're not. Oftentimes you're moved to an environment where you don't know the caregivers at all, right? And it's not in your town, it's not your neighbors, it's not down the street. So you may be moving cities, schools, childcare settings. You may have new smells, tastes, clothing, language, everything changes. And that by itself, if part of trauma is about loss of connection and not having a nurturing environment, you perceive that as a child, no matter how loving people are, right? So there's two aspects to trauma for our kids in care: the separation and whatever it was they were being separated from. The way that looks is a lot of circling back to what we talked about earlier. It shows up with emotional distress, mental illness, physical conditions. Oftentimes, kids who are entering foster care were already more vulnerable to neglect or abuse because of congenital conditions. Maybe they have chronic disease, they're on complex medication regimens, or they have a disability, and their parents, because of addiction or mental illness, were not able to provide in a way that left that child unsafe. So there's a lot of different types of health conditions that we see in foster care. The beauty of foster care is that you get to watch these kiddos recover. So you'll have kids who come in and their trauma before entering, and maybe in part from entering itself, they're not talking at all. They don't smile, they don't laugh, they don't walk. And within a few months, they end up singing a song to you or running across the room. Our older kids can be really angry for good reasons, and they might have mental health conditions or physical conditions that have held them back from being a healthy school age or teenage child. And you watch them start to really change too. And they're compassionate because they've been through a lot. They can be really giving. And you see what happens when trauma is resolved, when you have a healthy, positive learning, or rather caregiving environment. I think my best days in clinic were actually my older patients would bring their report cards to me. These were kids who were failing, had been held back 2 or 3 times, and they'd come in with A's because this is who they were meant to be, right?
Right.
But when the stress of a negative household environment, the abuse and neglect ends, they can begin to recover. And that's what foster care should be. It's this temporary situation while parents get better. But while they heal, the kids need to heal during that time.
Right. That's awesome. That's really awesome. You got to see those things and be a part of that. I mean, I think we talked about that earlier. It's just so rewarding to be a part of that. Anyways, I got 2 more questions for you because I know we're running close on time. So I want to kind of bring it back to our current situation. Something that you talked about earlier is that like first. Some parents, they're spending a lot more time with their families, a lot more time with their kids, and that can bring on stress. And kind of like what we talked about also is how this can be a very traumatic experience right now that we're going through. And so I kind of just wanted to hear like some of your recommendations or suggestions of ways that we can help children and adults like overcome toxic stress and be able to build more protective and resiliency factors so that like they can be stronger through this.
Yeah, that's a great question. I think a couple things I've noticed is if parents can keep the expectations realistic,
Mm-hmm.
it really helps take the stress off of the whole family, right? Like our bar, I will tell you, for our family is really low. And so we've kept it low because we can hit that bar most days, right? And so when we add in too many expectations, every day is going to be great, every day we're going to bond, every day we're going to have fun, you end up feeling like you were short, right? Or every day the house is going to be spotless and we're going to be organized and structured and scheduled. It's not possible to achieve that, especially when no one's getting a break, right? There's not these natural pop-offs of going out to the store or going out with friends and things like that. So I think setting realistic expectations. I do think some kind of routine and structure as a starting place gives people a sense of normalcy, so that they don't fall into health habits that kind of can bring you down, right? You stop going for walks. Maybe you never went for a walk. Maybe you need to start going for walks, whatever it is. But there are some really healthy behaviors that we need to lean on during COVID-19 isolation or quarantine, whatever it is we're doing now. But I think um, whatever outdoor time you can get, whatever sun time you can get, healthy eating if you can. But there's another side to COVID-19, which is actually the more, I think, hidden side, I would say, of being home all day. And that is for parents who are already coping, they're going to get through this okay, right? Like they have the resources and they have the family and friends to lean on and the technology and the financial resources to pull from to do what they need. It's the families who are already maybe struggling with addiction, mental illness, family violence. We're just marginally getting by day to day. Being home all day with your kids when you're struggling with those things is incredibly stressful and introduces toxic stress all day to your children. So whereas they might have spent 4 to 8 hours a day outside the home, which kind of fills their bucket, also allows the parent to fill their bucket back up. I think that's the part that we need to really think about as a community. How are we allowing families who know they're struggling to come forward without shame or fear and seek help on behalf of their children? that is going to be the most important way that we move forward. Lots of agencies have done a fabulous job of providing those supports. I think there's a lot of room for every family to know what's out there. Um, for those families who are struggling with family violence, addiction, mental illness, or just poverty, housing insecurity, food insecurity, I think we all need to allow them to come forward safely, receive them with compassion and equity, and that's how we can help them protect their children through this.
Wow, that's great. And thank you, yeah, for sharing all that. And so I want to close because this is a with a quote that you said, and it kind of follows up with like when you talked about seeking help. And so I want to read the quote that I read from one of the articles, which I thought was really beautiful, which where you said, "Childhood is such a precious time. This connection that what happens in childhood matters forever is powerful for everyone to embrace. It affects me as a mom every day. Sometimes life gives us challenges we don't ask for, and it may be depression or a loved one who struggles with addiction. Some folks lose their homes, but we have to know the strongest prevention act is asking for help." And gosh, I mean, I love the beginning of that with just saying how precious childhood is, because I really believe that. And how connection is just so important, just in general for all of us as people. And so like, I wanted to just kind of close out and ask you, like, why do you think it's like so hard for people to ask for help? And what are ways that we can seek help? And for those of us that are just struggling kind of to seek that out.
I think what I've seen over the years is that people don't ask for help for really two reasons. One is shame.
Mm-hmm.
It's much better how open we are about what's happened to us. I still think there's historically a lot of reluctance and shame to come forward. And the more we normalize trauma, uh, adversity, stress, bad times, it should be like talking about your car. It should just be that easy. It is so common to experience adversity. We just be able to talk about it like it's a normal part of human existence and move from there. That will make it easier for people to ask for help. I think the other side is people have often asked for help and not been received in a way which made them feel validated, safe, um, and accepted for what they needed. And so on the service provider side, we really need to be aware, oh, this person's asked me for help. They believe they have a need that they need me to help them with, and be aware of how we receive that. Because if we don't receive their request for help well, that can lead to that family shutting down and disappearing for a long time. And that's when we see kids who aren't graduating, they're not reading, they're struggling, they're going to juvenile detention, and so I think that's where how good are we at offering help when someone asks for it. I think the last thing I would just say is if people have asked for help in the past and weren't received well, keep trying. There's tons of people out there ready to help and want to help, and we just have to keep asking until we find the right person. Right? I think the main resources I would mention are 211, Tarrant Cares. ACF has set up a wonderful hotline that you can call for resources. There's a Texas COVID mental health hotline. And the last one I'll mention is Child Help, which is an anonymous parent stress hotline, or a child can call. It's texting or a phone number. And they'll just talk to you any time of day, 24 hours a day, multiple languages. If you're scared, if you're stressed, you might do something you'll regret. So there's a lot of help out there, but we have to keep at it. Yeah.
Yeah. And I completely agree. And I guess something I just want to add is I just feel like, as people, like, none of us are perfect. And something that I read, and it was Brian Stevenson, who they just did that movie on him, Just Mercy. I read his book recently, and he talked about how we're all broken in some kind of way. And so I see that as, like, I feel like all of us, like, I think no matter who we are, we can all use help in some kind of way. And I understand how people feel shame and feel, or maybe just a little too prideful to ask, or just don't want to seek it. But we all need it in some way. Like, I know that for me, like how I got here, needed some kind of help, like the support from my family, friends, all those things. And so, I just want to kind of echo what you're saying, is that we definitely need to, like, it's no shame to ask for that, and because we all need it.
Yeah. Maybe the shame is to not ask. Right?
Yeah, maybe.
Maybe.
Anyways, Dr. Partap, thank you so much for joining me today, and
Thank
just all the things that you said were just so insightful, and I just can't wait to re-listen to this a lot of times, because I feel like I got so much out, and I just can't wait to review and all that stuff. And so, and also thank you so much for what you just all you've done in your career, and also just what you're doing in our community, and just making it a better place. And it just gives me so much hope in this world, like to have people like you and your coworkers out there just doing all these things. So thank you so much.
Wow. That's how we feel about you and all the people out there doing great work. We're, this much of it. And so we appreciate the connection we all have with each other. It's wonderful. This is great that you're doing these. Thank you.
Thank you. Appreciate it. All right. We're gonna take a little bit of break, and we'll be right back. Hi everyone. Um, Man, that was amazing. I took a little 5-minute walk to just kind of process all that Dr. Partap was discussing today, and I'm just, very inspired. It's just amazing to listen and to hear her experiences and her knowledge, and just not neglecting the realities of the tough things that we're going through right now, but also providing that there's so much hope that can happen through this. And so I was, super encouraged through my conversation with her. I'm so lucky that I got this opportunity. And so I hope that those of you in the DFW area really see Cook's Children's as a resource, as such a great resource. And as someone who works in the area, who knows people that work there, they definitely are what they say they are, really making an impact on so many people's lives. And so thankful for them, and just like the work that they're doing. I'm just so inspired by that. I do want to give you a little update that this is going to be the final podcast for the summer. I feel like this was one of the best ones to end on. And so I hope that what you get out of this one is to please share with other people, because I felt like so many people can use such an uplifting messages like those. And also just to kind of like what Dr. Partap talked about at the end, is to definitely seek help if we need it. We're all struggling in some kind of way. We all need support. We're human beings. We are social creatures. We need connection. And so sometimes we need to sometimes ask for help when we need it. And I think that what's really amazing is that the human spirit can be very strong, and can really come through for us in that way when we need it the most. And so please, if anything, please never be ashamed to ask for help or to seek that. As we are going through this season, I just ask you guys to continue to be healthy, stay safe, and also just please be kind to one another. And hope you guys have a great summer, and we'll see you next time.